Thank you, Senator Brazeau, very much for those comments. Thank you also for submitting your study to us, and I'm sure we have looked at it. I believe your statements here will have far-reaching impact, and it's very timely because we are considering draft considerations at this point. Senator Brazeau, perhaps I can kick off with a first question. You have mentioned earlier in this committee and now again that we need to look at Indigenous suicide prevention through the lens of gender, and more specifically through the lens of the male gender, because they are overrepresented in the suicide data of this country. In your view, did the framework adequately, I think I know the answer to this, but I'd like to hear you say this. How did the framework address the male Indigenous population? And if not, what would you have inserted in it?
Well, first of all, I thank you for the question. Obviously, if we look at the framework, it's more of a aspirational, document than anything else. But having said that, there's very little in there presently. And if we look at the last 10 years, if there would have been anything in there specifically for Indigenous peoples and boys and men, we probably wouldn't be here having these discussions this morning. And so I'm certainly hoping that, because, I'm not an expert. I'm not a psychiatrist. I'm not a psychologist. I'm not a researcher. But I have lived experience, and I know how to count. And when we see that every 3 out of 4 suicides are committed by men, well, maybe we're just doing what historically we've always done, and in thinking that men are strong and men are supposed to be tough and men don't have to go get help, and they'll sort it on their own. Well, I'm living proof that that's not the case. That's simply not the case. And so there has to be some, like I said, I'm not an expert there, but there has to be some strong language in teeth so that the next decade that the federal government, deals and comes up with programs, especially for Indigenous peoples, that there has to be strong language that we target those two populations. If not, I'm sad to say, but I'll make a bold prediction that if we don't deal with these two target populations, we'll be back here in 10 years, because hopefully if my health is good, I'll still be back here in 10 years. And I'll be saying, I told you so. And I hope that's not the case. I'm aware that many studies such as this often happens in the Senate and in the House of Commons when it gets backing from the current government. But I think we have to go deeper, and I think we have to target where the numbers are. And if we don't, we'll be here again. So it's up to us collectively to decide exactly what we want to do, what we want to recommend. But I would just say, we have to have the moral courage to say what needs to be said sometimes. This is the chamber of sober second thought. So, I don't know. I feel a lot of frustration and a little bit of anger in terms of, it doesn't seem as if anybody is moving on these things. So let's collectively do it, colleagues. Thank you.
So your observation or your recommendation is that we name significantly the population that you have described, as opposed to keeping it in the generals.
Absolutely. I do not see how we cannot. I do not see how we can go through this exercise and just turn the blind eye as to what the two most, the overrepresentation of Indigenous peoples, and we all know why. We're not going to discuss the reasons why. We're all intelligent enough to know why. But there's also boys and men. And so, if, healthy men may make, the violence end, We don't want Iron Men. We don't want Supermen. We want healthy men.